Oncology in Turkey. This particular video is about a very specific but highly sought-after type of medical help, prostate cancer treatment. For many patients, these treatment methods are a rather sensitive topic for obvious reasons. If you don't know why, God help you to keep it unknown. In this video, we will meet a doctor in a Turkish clinic who will explain how prostate cancer is treated in Turkey and what help is offered to patients here. Subscribe to the channel and make sure you don't miss any new videos about medicine in Turkey. Prostate cancer, also known as adenocarcinoma, is a malignant tumor originating from either connective tissue or glandular epithelial cells within the prostate gland. The tumor develops from these specific cell types. In the early stages, the tumor does not extend beyond the prostate and almost does not show itself. At the same time, the share of this disease in the overall cancer incidence among the male population is about 15%. In terms of prevalence, prostate cancer is second only to lung cancer. Cancer treatment in Turkey is a well-developed field of medicine. Turkish oncology hospitals are equipped with the latest medical devices and use advanced therapeutic developments. Doctors have excellent training and extensive experience. The comfort level for hospital patients is very good, the staff's attitude towards the sick is most caring and heartfelt, and the treatment costs in Turkey are lower than in many other countries. On our channel, you can watch a series of interviews with Turkish oncologists about treating various types of cancer. And today we are meeting with a specialist in the diagnosis and treatment of prostate cancer. Dr. Safetinkaya is a urologist with over 30 years of experience. He received his specialized education at the famous Akdeniz University in Antalya. He has worked in both public and private hospitals. He sees many foreign patients from other countries. Doctor, could you tell us, what are the symptoms of prostate cancer? What should alert a person and make him consult an oncologist suspecting such a serious disease? If prostate cancer is not a metastatic disease in its late stage, it does not show any noticeable symptoms. That would be significantly different from normal prostate enlargement. Normal prostate enlargement, which is benign, can lead to symptoms such as increased frequency of urination, waking up during the night, and difficulty during urination, periodic infections, occasional bleeding, and at times, hemorrhaging. If prostate cancer has grown and metastasized, it can even manifest itself as pain in the bones because metastases frequently affect the human skeletal system. That's why it would be good to intervene before prostate cancer causes serious symptoms, rather than waiting for it to get worse. There are two possible options. If there were no relatives with prostate cancer in your family, then after reaching the age of 45, you should undergo a urological examination and determine the PSA level in your blood, that is prostate-specific antigen level. If there was a history of prostate cancer in your family, then tests should be conducted earlier, after 40 years, not 45. It is important to check PSA levels and undergo examinations after the age of 40. Doctor, there are many methods for diagnosing prostate cancer. If a person has some tests already done in another country or by other doctors, can he just come to you with those tests to start treatment here with you? Or is it mandatory to undergo all diagnostics here, in your clinic? Yes, the tests needed for prostate cancer have become almost standard. I am referring to universal global standards. First, a PSA test is conducted. Then, if the PSA level is extremely high, or if there is some enlargement or rapid growth of the prostate tissues, an MRI test should be performed, and additionally, if necessary, a biopsy should be performed. Depending on the biopsy results, if it is a localized tumor, local treatment should be commenced. And if the disease is not localized, there are various methods to study metastases. As I mentioned, these are universal things. They are standard in both developed and developing countries. To begin with, PSA tests and, if available, results of a needle biopsy are sufficient for us. What imaging techniques are available? It could be an MRI scan, or it might be tomography, or a method called PSMA PET-CT, or even scintigraphy. This is sufficient for us. What are the specific treatment methods unique to prostate cancer? We all know that some methods can be quite psychologically uncomfortable for patients for obvious reasons. So, can the patient choose the treatment methods themselves? There is a generally accepted treatment for prostate cancer. It is the gold standard for medical professionals. First of all, we determine the stage of the disease. At different stages, the treatment will vary. In the early stage, prostate cancer treatment is conducted in 3 ways depending on the patient's age and life expectations. He can undergo therapy in a hospital under close supervision. But if the patient says, "I cannot handle this kind of treatment, I cannot follow it, or I do not want to be closely monitored all the time," then we absolutely need to prescribe an invasive method of treatment. One of them is surgical, another is radiation therapy. Here, what's important is the patient's life expectations, expectations regarding bodily functions, loss of sexual functions, and urinary retention functions. We make the decision based on whether the patient agrees to this or not. And if the disease is in an advanced stage, then it entirely falls under the oncologist's responsibility. They can use various treatment methods, medicinal ones and others. As with any type of cancer, the prognosis for the patient's future depends on the stage at which treatment begins and the effectiveness of the chosen therapy methods. Turkey offers patients one of the best price-quality ratios in the world. There are excellent hospitals, skilled doctors, and the latest cancer treatment technologies at affordable prices. But to avoid making a mistake in choosing a clinic and a doctor, it's better to consult with independent medical professionals who know the specifics of particular hospitals and doctors. In Turkey, this can be done for free through a specialized service company. Its staff members are practicing doctors with valid diplomas and extensive experience working in Turkish clinics.
After a person submits a treatment request in Turkey, we, the coordinating doctors at Healthy Turkey, select the best clinic and doctors for him based on the diagnosis, preferences, and needs. As practicing doctors in Turkey, we know precisely how to perform it accurately, swiftly, and effectively. Next, we coordinate with the patient the treatment plan and constantly accompany him throughout the trip, as well as stay in touch for any questions even after his return home.
What factors would you consider the most important for successful treatment? When you talk about treatment, I understand that you are referring to the early stage. Of course, the stage is very important. When you detect prostate cancer at a very early stage, you have numerous treatment options available. Therefore, the main crucial factor is to detect the disease in a timely manner. At an early stage, the spread of the tumor is limited to the organ itself. Do you have many foreign patients, and from which countries do they mostly come? In my practice, about 8 to 10% of patients are foreigners. That's my practice. I'm not sure if this is a lot compared to others. Probably it's quite good. From which countries do most of our patients come? We have patients from Russia, Ukraine, the United Kingdom, and Germany, among others. There are patients who come from various Arab countries. Turkey stands out from other countries with its comprehensive approach to patient care. In other countries, you often have to pay separately for each procedure. The organization of medical tourism visits to Turkey under the all-inclusive system is managed by the Healthy Turkiye Company, which collaborates only with verified specialists in both medicine and hospitality areas, coordinating their work for each individual patient. Healthy Turkey takes care of everything, from consultations and agreements with the clinic and doctor to transfers and accommodation, migration formalities, and translations of medical documents. For consultations, you can contact this phone number or use the chat on the company's website. The address is on your screen. Also, you'll find there ample information on other health tourism fields. Don't forget to subscribe to our channel and never miss new videos about medical tourism and assisting foreign patients in Turkey.